The upper limb is a complex part of the human body. The anatomy of the upper limb is broken into compartments, such as regions, bones, joints, muscles, nerves and blood vessels, in order to understand its structure. These are divided into compartments to help focus on the necessary details. In this video, we are going to discuss the arteries, veins and nerves of each upper limb region: the shoulder, arm, forearm and hand. Altogether these form the neurovascular compartment of the upper limb. Upper limb arteries. The main artery supplying blood to the upper limb is the subclavian artery. The trunk of the subclavian artery is continuous throughout the entire upper limb. During its pathway, the artery changes its name based on the region it supplies. Thus, the major named arteries of the upper limb are the subclavian artery, the axillary artery, the brachial artery, and the ulnar and radial arteries. Arteries of the shoulder. The main artery of the shoulder is the axillary artery. It originates from the subclavian artery at the lateral margin of the first rib and enters the shoulder region. The axillary artery supplies the content of the shoulder and the arm via its 6 branches that each originate from the trunk of the artery in the following order: superior thoracic artery, lateral thoracic arteries, thoracoacromial, subscapular, anterior circumflex humeral, posterior circumflex humeral arteries. If you want an easy way to remember the branches of the axillary artery, check the video on upper limbs mnemonics on this channel. Arteries of the arm. The major artery of the arm is the brachial artery, which continues from the axillary artery at the lower margin of the teres major muscle. The brachial artery ends at the apex of the cubital fossa by giving off the forearm branches, the ulnar and radial arteries. The brachial artery supplies the content of the arm via its 4 branches: profunda brachii artery, nutrient artery to humerus, superior ulnar collateral artery and inferior ulnar collateral artery. Arteries of the forearm. The forearm region is literally full of muscles, with 20 of them laying within 2 compartments, all requiring a rich blood supply. The forearm region is thus supplied by 2 major vessels, the radial artery and ulnar artery. These arteries originate from the brachial artery at the apex of the cubital fossa, with the radial artery descending through the lateral part of the forearm and the ulnar artery through the medial part. Both arteries give off their main branches within the forearm, with the radial artery giving the radial recurrent artery, palmar carpal branch and superficial carpal branch, and the ulnar artery giving the ulnar recurrent artery, muscular arteries, common interosseous artery, dorsal and palmar carpal arteries. Again, use the mnemonic on the suggested video to learn the branches of the ulnar artery very easily. Arteries of the hand. The radial and ulnar arteries both end in the hand, anastomosing with each other. The radial artery mainly supplies the thumb and the lateral side of the index finger, while the ulnar artery supplies the medial side of the index finger and the rest of the fingers. Seems weird how only 2 arteries supply such a complex structure like the hand is. Well, thank goodness it isn't a handful of information to learn here. These 2 arteries form 2 anastomotic arches in the palm, called the superficial palmar arch and deep palmar arch, from which minor arteries to the muscles, digits and joints of the hand originate. Upper limb veins usually accompany main arteries, which is also the case here. Since the veins convey blood from periphery to the heart, we'll discuss the main veins of the upper extremity starting from the hand to the shoulder. The hand has 2 venous networks that drain it. There are deep veins which accompany the arteries, and superficial veins which anastomose into a dorsal venous network. This superficial network is located at the dorsum of the hand. The basilic vein originates from the medial side of the dorsal venous network, while the cephalic vein originates from the lateral side. The 2 mentioned veins, basilic and cephalic, are the main veins of the forearm. They are superficially located, with basilic traveling through the ulnar, and cephalic traveling through the radial side of the forearm. Besides these two, the median forearm vein assists in draining the forearm. It travels through the middle of the forearm. All three veins of the forearm tribute to the brachial veins. The veins that drain the arm are the paired brachial veins. The brachial veins are deep veins that are positioned like some kind of bodyguards around the brachial artery, one travels along its medial side and the other along the lateral. Their tributaries are the veins of the forearm and the veins that accompany the branches of the brachial artery. All of them together tribute to the axillary vein. The main vein of the shoulder is the axillary vein, which conveys blood from the shoulder and arm. It begins at the lower margin of the teres major muscle formed from the basilic vein and later the cephalic vein, gathering tributaries within the shoulders. It ultimately becomes the subclavian vein at the lateral border of the first rib. Nerves of the upper limb. The upper limb is supplied by a nervous network called the brachial plexus. This plexus is made by the merging of the anterior rami from the lower four cervical nerves and the first thoracic nerve that is C5 to T1. The plexus is anatomically divided into roots, trunks, divisions, cords and finally, the terminal branches. Terminal branches of the brachial plexus are the musculocutaneous nerve, which innervates the anterior compartment of the arm, including the skin of the lateral side of the forearm. The axillary nerve, which innervates the deltoid, long head of the triceps brachii and teres minor muscles. Provides sensory innervation for the shoulder joint and the skin-covering region of the deltoid muscle. The median nerve, which innervates the anterior compartment of the forearm, except for the flexor carpi ulnaris and medial half of the flexor digitorum profundus. This median nerve also supplies the thenar eminence, that is opponens pollicis, abductor pollicis brevis, flexor pollicis brevis, then the lateral lumbricals, and the skin of the lateral hand. The radial nerve, which innervates the posterior compartments of the arm and forearm, skin of posterior arm, forearm and the dorsolateral part of the hand. The ulnar nerve, which innervates the flexor carpi ulnaris and medial half of the flexor digitorum profundus, the hypothenar eminence, that is opponens digiti minimi, abductor digiti minimi, flexor digiti minimi brevis, palmaris brevis, then the medial lumbricals, dorsal and palmar interossae, adductor pollicis, and the skin of the medial hand. Now in summary. Arteries. Shoulder. Axillary artery and 6 branches: superior thoracic, thoracoacromial, lateral thoracic, anterior circumflex humeral, posterior circumflex humeral, and subscapular arteries. Arm. Brachial artery and 4 branches: profunda brachii artery, nutrient artery to humerus, superior ulnar collateral artery, and inferior ulnar collateral artery. Forearm. Radial artery and its branches, which are radial recurrent artery, palmar carpal branch, superficial carpal branch, then ulnar artery and its branches which are anterior ulnar recurrent artery, posterior ulnar recurrent, muscular arteries, common interosseous artery, dorsal carpal artery, deep palmar artery, and palmar carpal arteries. Hand. Superficial palmar and deep palmar arches, formed by the anastomosis of the radial and ulnar arteries. Veins. Shoulder. Axillary vein. Arm. Brachial veins. Forearm. Basilic, cephalic and median forearm veins. Hand. Deep veins and superficial veins which form the dorsal venous network. Nerves. The nerves of the upper limb originate from the brachial plexus and include the musculocutaneous, axillary, median, radial and ulnar nerves.